Welcome to TrickFit. In this segment, we're focusing on pre-diabetes, a condition that affects millions but often goes unnoticed. If you've ever been told your blood sugar is a little high, this video is for you. Understanding pre-diabetes is your first step toward preventing type 2 diabetes and protecting your long-term health. Pre-diabetes affects over 1 in 3 adults, and most don't even know they have it. It's a silent condition that quietly increases your risk for serious health problems, including type 2 diabetes, heart disease, and stroke. The good news is pre-diabetes is reversible. With early detection and the right lifestyle changes, you can stop it in its tracks and reclaim your health before complications arise. This video is part of the TrickFit Nutrition series, where we break down complex health topics into clear, actionable insights. Let's explore what prediabetes really means and how you can take control starting today. What is prediabetes? Prediabetes means your blood sugar levels are elevated, higher than what's considered normal, but not yet in the diabetic range. This signals that your body is starting to struggle with how your body regulates blood sugar, even if you feel perfectly fine. It's important to understand that prediabetes is not diabetes, but it's a transitional state. Your metabolism is shifting, and without intervention, it can progress into type 2 diabetes. Think of prediabetes as a flashing yellow light. It's your body's way of saying, pay attention. The good news is, this is your chance to take action and reverse the course before more serious complications arise. Prediabetes is a serious health condition that increases your risk of developing type 2 diabetes, heart disease, and stroke. So what causes prediabetes? The primary cause of prediabetes is insulin resistance. This means your body cells no longer respond properly to insulin. Insulin is a hormone that acts like a key to let blood sugar into the cells for use as energy. To make the cells respond, your pancreas pumps more insulin. But when pancreas cannot keep up with its job, your blood sugar rises. This leads to prediabetes, then type 2 diabetes. When insulin doesn't work efficiently, glucose or blood sugar stays in the bloodstream instead of being absorbed. Over time, this leads to elevated blood sugar levels, which can silently damage organs and blood vessels. Several causes can trigger prediabetes, including genetics, a high sugar or high fat diet, and lack of physical activity. The Center for Disease Control and Prevention, or CDC, listed the following risk factors: insulin resistance, sugar builds up in the bloodstream, triggered by genetics, diet, and physical inactivity, and triggered by being overweight. One of the most challenging aspects of prediabetes is that it often comes with no apparent symptoms. Many people live with elevated blood sugar for years without realizing it until more serious complications begin to develop. In some cases, subtle signs may appear, such as darkened patches of skin around the neck, armpits, or groin. Others may experience fatigue, blurred vision, or increased thirst, especially as blood sugar levels begin to rise. Because of symptoms are often absent or overlooked, routine screening becomes essential. A simple blood test can detect prediabetes early, giving you the chance to take action before it progresses into type 2 diabetes. Risk for diabetes increases significantly after age 45 years old. As we age, our metabolism slows down and insulin sensitivity can go down as well, making regular screening even more important. Carrying excess weight, especially around the abdomen, and living a sedentary lifestyle are two of the strongest predictors of insulin resistance. Even small changes in activity and weight can dramatically reduce your risk for prediabetes. If you have a parent or sibling with type 2 diabetes, or if you had gestational diabetes during pregnancy, your risk is higher. These genetic and hormonal factors make early lifestyle changes even more critical. People of African American, Hispanic or Latino, Native American, Asian American, and Pacific Islanders are at greater risk also. These disparities highlight the need for culturally sensitive education and proactive screening for prediabetes. One of the most common tests is the fasting blood glucose test. If your level falls between 100 and 125 milligrams per deciliter, it indicates impaired glucose regulation, so an early sign of prediabetes. The A1C test measures your average blood sugar over the past 2 to 3 months. As a result, between 5.7 and 6.4% suggest prediabetes and signals that your body is struggling to maintain stable blood sugar levels. The oral glucose tolerance test, or OGTT, checks how your body handles sugar after a sugar-rich drink. If your blood sugar is between 140 and 199 milligrams per deciliter 2 hours later, that's considered prediabetes. Why prediabetes matters? Prediabetes doesn't just lead to diabetes. It also increases your risk for heart disease, stroke, and other serious complications. Elevated blood sugar can damage blood vessels and strain your cardiovascular system even before diabetes is diagnosed. The effects of prediabetes are often invisible, but they are not harmless. Over time, high blood sugar levels can quietly damage your kidneys, eyes, and nerves, setting the stage for long-term health issues. The most important message is you can reverse prediabetes. With the right lifestyle changes, you can restore insulin sensitivity, improve your blood sugar control, and prevent diabetes altogether. This is your opportunity to take control before you begin having complications. How to reverse prediabetes. Research shows that losing just 5 to 7% of your body weight can dramatically improve insulin sensitivity. That is 10 to 15 pounds for many people, and it can make all the difference in reversing prediabetes. Regular physical activity is the key. Aim at least 150 minutes per week of exercise. That's just 30 minutes a day, 5 days a week. Walking, swimming, dancing, or strength training all count toward improving blood sugar control. Focus on meals that are rich in fiber, lean protein, and healthy fats. Whole grains, vegetables, legumes, and nuts help stabilize blood sugar and keep you full longer. Don't underestimate the power of stress management and quality sleep. Chronic stress and poor sleep can spike blood sugar and worsen insulin resistance. So prioritize rest and relaxation as part of your health strategy. One of the most effective approaches for reversing prediabetes is the Mediterranean style diet. It emphasizes leafy greens like spinach, kale, and arugula, rich in fiber, antioxidants, and essential nutrients. Lean proteins such as chicken, turkey, and legumes help stabilize blood sugar and keep you feeling full. And fatty fish like salmon, sardines, and mackerel provide omega-3 fatty acids that reduce inflammation and support heart health. Healthy fats from olive oils and nuts, foods that support stable blood sugar and heart health. This way of eating isn't just a diet, it's a lifestyle rooted in balance, variety, and whole foods that nourish your body and protect against chronic disease. Sugary beverages and refined carbohydrates like white bread, pastries, and soda can cause rapid spikes in blood sugar. Cutting back on these items is one of the fastest ways to reduce insulin resistance and improve blood sugar control. Even healthy foods can contribute to elevated blood sugar if you consume large portions. Learning to recognize appropriate serving sizes and practicing mindful eating can help you stay within your nutritional goals. There is no one-size-fits-all solution. Working with a registered dietitian nutritionist can help you create a plan that fits your lifestyle preferences and health needs, making it sustainable and effective long term. Prediabetes isn't something to ignore. It's your body's way of saying, it's time to make a change. It's a wake-up call, not a life sentence. And the earlier you respond, the better your chances of preventing long-term complications. The power to reverse prediabetes is in your hands. With the right nutrition, movement, and mindset, you can restore balance to your blood sugar and reclaim your health starting today. This is just the beginning. Subscribe and stay tuned for more TrickFit insights where we break down nutrition science into simple and actionable steps that help you live your healthiest life. Thank you for watching.